can we even help varicose veins? Well, I think we have to ask some different questions. So today's video, I'm going to walk you through the things you should be asking, and maybe we ought to be going from a different direction, a different perspective. So let's start here. Let's understand the venous system compared to the arterial system. Well, guys, listen, it's very simple. Arteries actually carry the blood from the heart, oxygenated to all parts, usually the extremities and farther, and all to all the vital organs. But then the venous system, actually the veins, what they do is they now bring all the blood back once oxygen has been delivered or nutrients been delivered, and brings it back to the heart to be reoxygenated and re-nutrients and all things like that, and bring it back into circulation again. But what happens is, nice thing about arteries, there's a pump. The heart is actually using pressure to push it out. On the flip side, veins are different. Veins actually deal a lot with muscle contraction to actually bring it back. Now, when you have chronic venous insufficiency, you can have things like varicose veins and hemorrhoids and other chronic venous insufficiency symptomatology or even conditions. So I want to think about this way. So can we help them? Well, we got to think about the circulation when it does come to the veins itself. So what happened? Well, the blood starts to pool within the veins. The endothelial line, the lining of the veins can be damaged, can be weakened. Blood starts to pool there, they move out. So what can we do? Well, first of all, I want you to think of it this way. One of the best things you can do with the varicose veins is just compression. It's just compression itself. That's why they sometimes have compression socks and different things wherever you have it that way. Or on the flip side, remember, muscle contraction is one of the greatest things and the primary thing that does, move veins to bring the blood back. That's why if you notice, if you exercise or move or vibrates, you get contraction, and therefore what happens? You get better blood flow coming back to the heart through the venous system. But chronic insufficiency of the venous system can happen in many other ways too, because we forget about there's a system that we call the Hepatic Portal System. Now, what do you mean that? The veins actually come from the intestinal tract and go back into the liver. Now, guess what happens? If you do have scarring of the liver or even fatty liver, there can be a backup within that system. So that's why even liver problems can contribute. But let's take a look now at some of the things that can contribute to it. First of all, just not a lot of movement. Okay, not a lot of movement. That's a big thing. So guys, when we look at trying to even repair, any kind of venous problem that way, just start moving. Now, once again, and being a chiropractor, a lot of people say, well, doc, I have bad joints. Any kind of muscle contraction, even a simple walk is gonna help. Now, would it be nicer to have a little bit more intensity of exercise and some good muscle contraction? Yes, it would, because that would compress the veins. That would start to move the pooled blood out a little bit faster and a little bit better and actually circulate it much better. And it takes a lot of pressure off of that venous system. But then if you ever look at the other things that do it, inactivity, pregnancy, hormone replacement therapy, weight, all these things can put, pressure on the venous system and have some issues. Now, a lot of people say, doc, so even certain hormone therapies, yeah, or even abnormal hormones themselves, more related to the estrogens. And that's a whole nother topic right there, because there can be some hormone contribution during pregnancy, during certain stages of life, during menopause, because if estrogens are not normal, there can be a contributing factor to that. So even seeing if your estrogen levels are normal, that can be a contributing factor. So to help the venous system, you'd want to actually start to normalize that. But I want to kind of come back also to just fatty liver or scarring of the liver, because once again, as some of that blood flow from the hepatic portal system is brought back to the liver, if there's an issue with the liver, there becomes a backup there. So even helping liver function start to normalize does help with our venous system, because one thing that happens when you start to notice that there's varicose veins and there's pooling there, more pressure has to come, and that's why we see a lot of times when there's these problems, there be some blood pressure contribution. So did the blood pressure affected, or was it the blood pressure resulted from having chronic venous insufficiency? So all these things contribute to it. So when people say, is there something natural I can do or take? I don't really think so. Now, what we can do is when we start to use compression, when we start to address the estrogens, we start to address the hormonal component, we start to address maybe the liver, the scarring, or the fatty liver disease. Obviously, pregnancy, we can do things like movement and exercise to have a lesser chance of that happening. There are some things that you can do to actually help the endothelial and some microcirculation of the venous system that does work, okay? But I wouldn't use this as when people say, can I take this to make my varicose veins, go away? I'm gonna say I don't believe so. But I will tell you this, if you start doing all the other things that start to contribute to good vessel health, good arterial and also vein health, especially with the venous system, then if you take these things, then I believe you're gonna see some repair process that might have some good effect on it. And my favorite thing is actually ginkgo. Now, why? Because it actually helps improve microcirculation in the venous system. It also helps with the endothelial function. So therefore that lining within that vein has to be very strong so there's not a pooling or a pocket or a bulge out of the material itself. But also it helps reduce the oxidative stress that happens within there. Another thing I also love, a form of vitamin C that's a whole food complex, not more ascorbic acid. Why? Because vitamin C is very pivotal in actually helping produce collagen and elastin that makes, these things very, strong. Okay. I also like the foods that contribute to it that way. You look at foods that are citrus. Citrus foods do a wonderful job at it. Also bell peppers. We look at bone broth on its collagen production. Organ meats, also berries. So when we look at these things, those things are wonderful to contribute to some of the repair process that you can start taking and eating to not only when you start doing compression and movement and make sure that you have good liver health, but all these things contribute to it. One last thing I also like too is heat, infrared. I think that is a contributing factor to one's skin, help with circulation and also allowing the vessels to have some pressure off it in order to actually have better circulation, both in arterial and venous. So these are just some contributing factors that I like to do. So when people say to me, what can I take to help my varicose veins? I think that the question should be, what can I do to actually improve vessel health? And I do believe that compression and movement are the two most important things to start with. And then when you get all the other factors contribute from hormones, from your liver function, you can now add those key things that I talked about in from the herbs or the foods. And I believe that you can see some progress for what you want when the way their varicose veins look.